just had your baby, yay, but now you are being told your little one will need to be spending time in the NICU. Today we are speaking with a NICU nurse and we'll be answering all of the common questions you might have about NICUs. Thanks for joining us. This is Newbies.
He's gorgeous.
It's a girl.
Surprise! The whole family's here!
So when are you having the next one?
It's just poop.
Ready for another?
Wow, you look really tired.
Ready to go back to work?
Yellow poop? Seriously?
Did you sterilize this?
Sex? Now? You've got to be joking.
You should sleep when the baby sleeps.
She doesn't look anything like you.
I thought you already had your baby.
I did.
Babies don't come with instructions, so there's Newbies, helping new moms and new babies through the first year.
Welcome to Newbies. My name is Kaile Garcia, and I'll be your host today. If you haven't already, be sure to visit our website at newmommymedia.com and subscribe to our weekly newsletter, which keeps you updated on all the episodes we release each week. And if you're looking for a way to get even more involved with our show, then check out our online community. It's on Patreon. That's where we chat more about the topics discussed here on our show. You'll get behind-the-scenes extras and listen to our podcast ad-free. It's also an easy way to learn about our recording so you can join us live. Our expert today is Theresa Hunt, who is a NICU nurse at a children's hospital in Northeast Ohio. Theresa, thank you so much for joining us. Please tell us more about your family and what got you in the work to being a NICU nurse.
Hi, thank you for having me. I am a single mother of two. I have a 10-year-old daughter and a 7-year-old son. I've been a nurse for about, I think, a little over 10 years, maybe 11 years. And the last 7 years, I have been working in a level 3 NICU.
I'm so excited. Really quick, so for those who don't know, what are the different levels associated with NICU care?
So starting at level 1 would just be like a normal, like, nursery where they keep the babies. Sometimes when you're sleeping, they do their normal exams. I believe a level 2 is more of a special care nursery. They might be able to do some sort of an IV and like some nasal cannula, a little bit of oxygen, but not anything more than the nasal cannula with the oxygen on the wall. And then a level 3 where I work. And then there's an age gap too. I think a special care nursery would take babies like at 34 weeks and up or 32 weeks and up or something of that nature. Where I work, we take babies anywhere from 23 weeks and up, and we can do IVs, we can do heavy respiratory equipment. We just don't do surgery. And then a level 4 NICU does everything. They do surgery. Yeah.
So with a level 4, I guess, if someone gives birth at a hospital that doesn't have a level 4 NICU, then the baby typically gets transferred? Does mom and pediatrician and parents, do they typically find out early on?
Yeah, so sometimes they can find out early on based off of different imaging and things that are done during pregnancy, or even if something occurs during pregnancy where they can kind of get a heads up and know that mom's going to be on bed rest for a while, or they need to, deliver early. They can kind of be ahead of the game. At the hospital that I work for, we do deliver. So a lot of times if a mom is still pregnant and they have time, they will just transfer mom to our hospital before she has the baby. That way that they're already, in the hospital, and it's a lot quicker process to get baby. Otherwise, they will transport baby to the hospital after the baby is born.
I think this is so interesting. Yay. Okay, well, we'll start diving into more of today's topic. But first, let's take a quick break. Today, we're discussing the first week inside the NICU and what parents might expect. And we have an expert here today. So, Theresa, first question for you. Tell us a little bit about your shift. I know we talked about the different tiers hospitals could have, but do you work with newborn babies or babies who have been in the NICU for more than a few days, or kind of a combination of both?
A combination of both. So depending on how experienced you are as far as like as a nurse in the NICU, how long you've been there, kind of depends on what type of babies you will take care of. We use the term feeder growers a lot, and that would refer to a baby that is not really requiring any more like medical equipment. They don't really need IV medication or IV fluids. They don't need respiratory equipment anymore. They are now just there to learn how to eat and grow until they're big enough to go home. So a lot of times that's what our newer employees will start with and kind of learn that basic stuff. And then the longer you're there, the more experience you are, the more of the different training classes that we have, and the more skill you gain, that's when you start taking care of the more critical babies that are maybe born a lot earlier. They're a lot smaller. They require more IV medications and fluids, and they're on like respiratory equipment. Some of them might be intubated where they have a breathing tube down their throat. So it kind of just depends. Since I've been where I am for 7 years, I pretty much can do everything. So depending on who's there, who had babies yesterday, it depends. It will depend on what kind of assignment I get. So I can do either I'll have a critical assignment where I have one or two babies that were, on the critical side. I might have three babies that are all just kind of there to get a little bit bigger and grow. We have a position where you're the resource nurse, so you don't have an assignment. You help the other nurses do different tasks if they need help. And then I go to the deliveries whenever they call and say that they need NICU at a delivery.
So you kind of answered my next question a little bit, but why might a baby be taken to the NICU? And I'm sure there are more than 10 dozen different reasons, honestly, but name some of the common ones that you experience. And obviously location and hospital change, but what are some things you see that, a baby might need to be taken to the NICU?
So our automatic NICU admissions would be any baby that is born before 35 weeks. They have to come to the NICU. If they're born above 35 weeks, they are allowed to stay with mom as long as they don't require respiratory support. We would give a baby an IV, say there was an infection risk and they need antibiotics, they would need an IV. Sometimes babies that are born to diabetic mothers, they have issues kind of maintaining their blood sugar. They come to us quite a bit to get replacement of the blood sugar through an IV. We have some babies that are full term that don't transition well, so they need respiratory support. And then I think the last category, kind of generalized, would be a baby whose mother was on drugs and the baby is now withdrawing. So now they have to come to us also.
So we were talking a little bit about why a baby would go to the NICU. So I'm curious about working with parents, specifically new parents. This is their first baby. How are you navigating the conversations of kind of scary topics with new parents?
So you kind of want to start with expectations. You try to kind of let them know that, everything that we're doing, we see a lot and kind of what we typically see. And then sometimes you want to make sure you let them know, like, kind of what to expect. I think that seems to kind of help people. Like, for an example, a lot of times our babies need IVs. They have really small veins. They don't always last very long. As an adult, you go in the hospital, you get an IV, it might last you the whole time you're there. A baby's IV, depending on how active they are, could last a couple hours or a day. So I like to tell parents, when they have to get an IV, it might start out in the hand, but, next time you come back, it might be somewhere else. And a lot of times we put them in the head. So I feel like doing stuff like that kind of helps prepare them for things that they might see so that they're not shocked when they come in, and kind of just give them something to look forward to as far as, having that expectation and easing a little bit of the anxiety. A lot of issue too with new parents is giving them an opportunity to do what they can. A lot of times you're not even able to hold your baby right away. So, having them put their hands in the isolette and holding the baby's hands, or helping you with a diaper change, or even just offering a binky, those little things, really kind of help start the bonding process, give the parents some control, and, feel like they're active in their baby's care.
And I can imagine the care would be different, obviously, for new parents if their baby was born at 28 weeks compared to 36 weeks. Can you talk a little bit about the difference in care, generally speaking, and not dire situations, but the care difference and how involved a parent could be? Like, what are some things that they could ask to do if their child was born at 36 weeks and just needs a little bit of extra help?
So when they're born earlier, they're typically with IVs. They usually have some sort of respiratory equipment. Depending on how early in the situation, they might not even be allowed to come out of the isolate. But most times they can, and we coordinate that with, the respiratory therapists and doctors, and they can do skin to skin still, even, with all the things that they have attached to them. So I like to let them know, when they can do that. Also letting them know, hey, you can kind of come in here and asking for help. Sometimes I let parents help weigh the baby when they're in the bed. You just lift them up and then put them back down. And sometimes I will ask them to help me with that, things like that to help. And then as a baby's older, 36 weeks, and that's a first time parent, they might need to know, okay, how do I change a diaper? I've never changed a diaper before. Or let me show you how we give baths here, like a quick wipe down. And a big thing is feeding. Babies that are born early do not possess the ability to suck, swallow, and breathe all at the same time. So it's kind of a process to learn. You can't just sit the baby in the crook of your arm, put the bottle in, and wait till they're finished. You really have to pay attention to, are they breathing? Are they sucking? Making sure that they're not choking. We have different positions that we feed them in, and really kind of learning those skills so that they can take their babies home safely would be more things that you work on, like with an older baby.
And getting into feeding, I guess, depending on when a baby's born, would determine the success rate, right, of breastfeeding a NICU baby. I've heard so many positive stories. We have a whole breastfeeding podcast about, NICU babies having long, lovely breastfeeding journeys with their moms. Talk a little bit about that. What conversations do you have with moms who want to breastfeed their NICU baby, but for instance, I didn't know that they couldn't, suck and swallow like a full term baby. So what type of conversations do you typically have with them?
So we always ask when they're born, what is their plan? Do you plan to breastfeed? Do you plan to, kind of just do formula? If they plan to breastfeed, if their baby is not able to go to breast yet, we obviously, give them everything to pump and give encouragement on how to kind of keep their supply. And then they're exclusively like pumping for a good amount of time until the baby's old enough to eat. Typically, even if they're not able to like eat, if they're not old enough yet, because around 34 weeks, 32 to 34 weeks is when the doctors will say, okay, now they can start eating and it's safe enough for them to, swallow. What we will do is have mom pump and then put the baby to an empty breast, and we call it nuzzling. So baby's still getting tube fed, but they're able to start getting familiar with the smells, licking around, and then that kind of mimics the sensation of breastfeeding, even though they're not actually breastfeeding. Their bellies are getting full by the tube feed, while at the same time they're kind of like licking and learning and like practicing at breast. We do have a lactation consultant that comes around and works with breastfeeding moms. We do weighted feeds a lot of time because while they're in the NICU, a big part of it is, measuring feeds and looking at growth. So I can't say, there are a few times when a mom has been able to exclusively breastfeed. Those are more of the full term babies that are kind of admitted for other issues. But as far as like the premature babies, we do allow parents to breastfeed and practice breastfeeding, and they can continue working on breastfeeds once they go home. But they do usually have to also work on bottle feeding because we have to make sure that the baby's getting the proper volumes for the proper weight gain. So they do a little bit of both with, while they're admitted.
And I guess what can parents do? I'm imagining parents who know that they're going to, have an induction early or a scheduled cesarean. So what can parents do to prepare themselves for their baby being taken to the NICU? What are like your top, I don't know, like 2-3 questions or 4 questions that you think they should definitely ask their NICU care team?
So typically when they put in a consult for the NICU, one of our providers will go over to the mom if she's admitted, explain the process of what may or may not happen, what the baby might need. And then we also, if they're able to get up, they are allowed to come over to our unit. We do tours, kind of show them around, kind of give them a rundown of what to expect, which I think is really nice because then when they do have to come, they've already kind of gotten a lot of information. I think the number one thing people want to know is how long will the baby have to be there? When can they expect the baby to come home? And a lot of times we try to say that there's an estimate of due date. It could be longer, could be sooner, but that's like a rough estimate that we like to tell parents. And then I personally, a step further, like to tell them all the things that need to happen before the baby can go home. So if the baby is small, they're in an isolate, they have to get big enough that they can be in a crib and maintain their temperature. They have to be able to bottle feed without the supplement of, tube feeding. They have to come off of, this respiratory equipment, like different little milestones they kind of have to cross in order to go home. And that just kind of lets the parents know that they're getting closer. So I think that
follow up to that is I've had a few friends who've had babies born premature. Can you talk me through just a little bit about the adjusted age? I think that is so interesting, specifically in terms to milestones. I'm thinking of one of my old friends, and she kept saying like, yeah, my daughter is 6 months, but 4 months adjusted, or maybe I'm backwards and she's 4 months, but 6 months adjusted. I'm not really sure. Can you break that down for those who don't understand?
So once they're born, like say the baby is born at 36 weeks. If a week goes by, now they are adjusted to 37 weeks. And so even though that baby is a week old, they're the equivalent of 37 weeks. So that's the way, I best understand it. So even though a child might be 3 months old, they're only adjusted, based on how early they were born. So like a lot of times our babies stay anywhere from like, a couple days to I think 3 months is kind of like the max for our stays. A lot of times 2 months for sure. So, you might tell your friend that, your baby's 2 months old, but they're only corrected to, 37 weeks if they were born, 2 months ago. So that kind of continues once they go home, if that makes sense. So you're kind of comparing how long they've actually been alive to what it would be if they were born at the correct time.
Well, we got more questions coming up, but first, let's take a quick break. Welcome back to Newbies. We are continuing our topic about NICU stay and the questions you might want to ask if you know that your baby is going to have some time in the NICU, or if you are a new mama and your baby is already in the NICU. So we covered a lot in the last section, but I have a couple of more questions. I guess specifically for the parents who, I like that you mentioned that most parents want to know when their baby's getting out, right? I can only imagine that would be the number one question. So for them who already have their babies in the NICU and are tuning in and listening, what are some things to kind of keep them optimistic, right, about their baby hitting their milestones? So any positive feedback or advice do you have for parents who are patiently waiting to, have their baby graduate?
I think the best thing, if possible, which I know is not always possible for everyone, is to really be there, to, really kind of absorb everything that's happening so that you can also kind of help in practice. Sometimes depending on how busy the hospital is and the workload, especially more so for older babies that are getting closer to going home and practicing, feeds, if it's kind of a crazy time and the nurse doesn't have time, they might skip, a bottle feed versus a tube feed because, they don't have time. But honestly, like, we can do everything we can. Parents can do everything they can. And it's ultimately up to the baby. They're the ones who dictate, when they come. They're the ones who dictate how long they're going to stay, when they're going to eat. So, I think the best thing to do is to know that you're doing everything that you can. This isn't your fault. There isn't anything that you could have, done differently. Sometimes things just work out this way. And just be there and, love on your baby as best as you can.
I love that. I think we didn't even get into your shift. Tell us a little bit about the shift you do. I know because I know you, but tell us a little bit about the shift you do. And I guess I know every hospital is different, but do you get a lot of, and I know you've done multiple different shifts, right, amongst your hospital, but do you get a lot of experience seeing parents? Like, what are the visiting, are there different visiting hours? I feel like that might even be a taboo question, but tell us your shift and your experience with working with parents at this odd hour.
Okay, yeah. So I work the night shift. I work 7 p.m. to 7 a.m. We have other shifts too where nurses will work 3 a.m. to 3 p.m. or 3 p.m. to
Mhm.
3 a.m., which the 3 a.m. just seems the oddest to me because I could not imagine going into work, at 3 o'clock in the morning. But
Yeah.
so it's honestly kind of the same, from day shift to night shift because we kind of work. So we work around the baby's feeding schedules. We call it cluster care because a lot of the babies aren't naturally supposed to be here yet. We really try to mimic the environment of the womb. We try not to bother them too much, let them, sleep as much as they can. They grow when they sleep. So depending on their feeding schedule, it could be every 4 hours, could be every 2 hours, could be every 3 hours. So night or day, we go in, we wake them up, change diapers, do an assessment where we listen to their lungs, kind of check them out, make sure everything looks good. And then we feed them either if they're allowed to take bottles or if we're doing tube feeds and, kind of leave them be until the next time. So the only difference I would say are sometimes we get some kids that are older who we don't have to mess with as much. Like they're really close to term or over
Mhm.
term, meaning between 37 to 40. I think the oldest I think I've seen is 42 weeks.
Mhm.
Those babies we might leave alone a little bit more. We might not check their vitals as much. We might not weigh them as often, kind of try to mimic that environment. We try to keep them up during the day, do tummy time, give them toys and things like that versus at night we try to let them sleep. So, and then each shift kind of has their own responsibilities. We do our baths at nighttime when I'm there, which kind of stinks for the parents, but if they want to do a bath, if they're not going to be there at night, they are more than welcome to do so. You on the day shift, but as a routine, we do the baths at nighttime. We change the IVs, all the bags and tubing. That's got to be a sterile process just to keep everything nice and clean for the baby. So we usually do that at nighttime. We do all of our weights at nighttime. Babies get weighed every night just so that we can track their growth. And so there's just different tasks at night. As far as visiting goes, at my hospital, the mother, and then we give her a support person. So that could be dad, if dad's not around, that could be mom or whoever her support person is. They are allowed to be at the hospital with baby 24/7.
Mm.
And then we give them a certain color. Ours are green. Those are for those two people. And then we give them 4 other bands that they can kind of give off to other support people. Those people are only allowed in during visiting hours and they're not allowed to bring anyone with them, but they could come, without the parents during the visiting hours. And then the parents are allowed to bring whoever they want, whether they have a band or not. And then right now, I live in Ohio, so it's cold and it's currently right now cold and flu season. So we do not allow children into the NICU. Anyone under 18 is not allowed it changes every year. I don't know how they track, the flu and things like that. But for this year, it started in November. And then usually between March and April is when they'll kind of lift that flu ban. And then siblings and other visitors are allowed to come and visit.
I like that you mentioned the whole process of how everything has to be sterilized. That totally makes sense. What are some things you've seen moms have in their hospital bag? Do they call it a NICU bag? I think that's so cute. That they can safely bring, if they are doing tummy time, if it is a little bit of an older baby who maybe just has a little bit of breathing issues. What are some things that maybe are ideas that you've seen for other NICU moms who are curious about just bonding with their baby? Can they bring onesies? What type of toys have you seen? Kind of answer that.
So we actually provide everything that they
Oh,
need.
awesome.
The only things that parents I've seen bring in, maybe they bring in a sound machine that they might want the baby to use. Or different little toys. They're not allowed to really have those things in the crib, because of safe sleep. But, they
Mhm.
kind of bring things in to decorate the room. Some parents are definitely allowed to bring clothes, but we do provide clothing there. We have swings for babies. We have those little crib attachment toys. We've got like these little fishy, I think it's like a baby Einstein's, like a little fish tank looking toy that we'll put on the crib, for an older child who, might need that stimulation. Typically, when they do tummy time, we have like mats that we'll put them on. Usually, therapy will work with that because they do the physical therapy with the babies during the day. So I'm not really there for those sessions, but I know that's a part of like what they do based on the baby's age, what things they should be doing and what type of like stimulation do they need. So, but yes, I mean, as far as what the parents bring, we provide everything. I mean, I've seen like some sound machines, but we have swings. I think I have seen a parent bring a swing in, like a personal swing, but typically we provide everything that they need. We use the same bottle at the hospital that I work at. We use Dr. Brown's bottles. And I think the parents can bring in whatever. We used to have them bring in whatever bottle they were going to use before they left, but we've recently switched to like only using Dr. Brown. So I think closer to going home, that's something that they can bring in, say they want to try something else. Once the baby's eating well, we can try it because they want to make sure that you don't go home and use this completely new bottle and the baby doesn't eat well and then you have, issues. So we typically will like to try to do it while they're in the hospital before they go home.
That makes sense. And I know for a lot of breastfed babies, it's so hard to find a bottle that
It
they like.
is.
So I can imagine if, a NICU baby has consistently had this, this type of bottle, that makes so much sense. Geez, you are full of wisdom. Thank you so much for coming on.
No
Last
problem.
fun question is tell me maybe if you can remember one of just like your favorite NICU graduation stories. I don't know if you've had a baby who maybe didn't seem like they were going to make it or was really,
I
really early. What's one of
Yeah.
your favorite stories that you can share to, I guess, give some of our moms who are listening some hope that, it's tough right now, but most babies get through it, I'm assuming. Don't quote me on
Yes.
that, at least where you work. But anyway, tell me a really good story that might uplift our mamas.
Okay. Well, my favorite story since I've been there was a mom. I don't remember why she had to deliver early, but I know she was very close between like late 22 weeks, like not quite 23. And typically, for sure, 23 weeks and up, they're coming to us. I think the 22 week itself, because we count 22 weeks and then 22 in one day, 22 in 2 days, we count each day until you get to the next week. So that 22 range is up to the providers and up to the parents. They really give them a good information about, risks and benefits and all those things and kind of work with the parents to decide how we should proceed. So anyway, this mother's baby was not quite 23 weeks yet. They gave her conversation, gave her everything she needed to know, pros and cons, what it would look like. And this mother decided that she did not want to send her baby to the NICU. She was going to have her delivery, let her baby go, and go on. And her baby came out, did okay. Nothing was happening. It was really hard for the mom. She asked one of the nurses offered to take the baby, hold the baby, kind of give her a break because it was very emotional, overwhelming. And the nurse says that she was in her office with this baby. Some, song comes on. I can't remember what song, but it was like I'm a fighter,
Oh.
very uplifting song. And she cried and she called our providers in the NICU and said, we got this baby. This was the plan. It hasn't happened yet. What should I do? So our provider goes over. They put a pulse ox on the baby to check the oxygen level, and it's amazing, as high as it could be. And they went to mom and said, what do you want to do? She doesn't seem like, she seems like she wants to be here. So they brought the baby over and did everything that, you'd normally do for a baby of that age, which is even more interesting because a baby that young, you would not be holding. We would have that baby in the bed. We would not even allow that baby to move very much for risk of a brain bleed. That's kind of just a standard precaution we do because they're at higher risk at a younger age. So, she had not done all those things and she wasn't properly, warm. Like our babies are normally in a very high heat isolate the younger they are. So, despite all those things, we bring the baby over, and I believe she's 4 years old now. No deficits,
Aw.
no, anything. And it's just like my favorite story to tell because I just couldn't, none of us could believe it. Usually, sometimes the earlier you are born, the higher you are of risk of deficits and different, complications. So that was just like a really amazing story to hear, that they were willing to kind of not do anything and let her go. And she decided otherwise. So
I love that story. I think that's such a fighter. I want to I want to
yeah.
hear the song she was listening to
Well,
that
I have to
uplifts
ask her because she
me.
still works there. I know it was by Andy Grammer, who I know is like a positive kind of artist, but I don't know exactly what song it was. But yeah, I mean, I would tell her mom all the time, I think she's going to be president or something important because she she's killing it. And she's already like feisty. So
Oh, I love it. Yeah, that's such a good note to end our episode. Well, Theresa, thank you so much for joining me. That wraps up our show for today. Thanks for listening. If you love Newbies as much as we do, please consider checking out our amazing businesses that sponsor our show week after week. And we'd also love for you to tell another new mama about this resource, which of course is absolutely free. And if you want to check out some of our other podcasts we produce, such as Preggy Pals, Parent Savers, The Boop Group, and Twin Talks, then visit our website at newmommymedia.com. And don't forget to follow us on Instagram for more information, giveaways, and more. Our handle is at New Mommy Media. Thanks for listening to Newbies.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey, mamas. Don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.